Bismillahirrahmanirrahim. Assalamu alaikum, dear students. Welcome to your channel, The Anatomy Canvas, with your tutor, Dr. Shehla Aman. In today's class, we are going to discuss with the histological slides for the preparation of the OSPE of Block C, that is cardiovascular system and the respiratory system. So this is your first slide for today's class, and this is the slide of the epiglottis. In this you can see on one side of the slide you can see this is the epithelium, and on other side you can also see the epithelium. So in one side you can see the epithelium is the stratified squamous non-keratinized side. This is the site of the epiglottis which faces the oral cavity and the esophagus, and this is the side where it is lined by the pseudostratified columnar ciliated epithelium. Beneath the epithelium you can see there is the submucosa, which is moderately dense connective tissue, contains some nerve fibers, some blood vessels, and a small amount of the gland. And core of the epiglottis is formed by the elastic cartilage. So this is the slide taken at the lower magnification of the epiglottis, and for identification point you can see in the core you can see the elastic cartilage, in which you can see the cartilage cells, the chondrocytes are present along with the elastic fibers, which you can see in this slide, and on both sides you can see the mucosa. So this is the same slide at higher magnification, in which you can see at one side the pseudostratified columnar ciliated epithelium is present, and just beneath epithelium you can see the moderately dense irregular connective tissue, and then the elastic cartilage at higher magnification, in which you can see the chondrocytes which are present in their lacunae, and also large number of the elastic fibers are seen in this slide. So this is another slide for the epiglottis, and here is the slide is taken from the view where the epithelium is changing from the pseudostratified columnar ciliated epithelium to stratified squamous non-keratinized type of the epithelium. So this is the area where the transition zone is present, and epithelium is changing from respiratory epithelium to that of the stratified squamous non-keratinized. At the surface you can see the squamous cells which are present, while in this area you can see the goblet cell and cilia are also present in this type of epithelium. Beneath epithelium you can see the moderately dense irregular connective tissue of the submucosa. Now another slide for the epiglottis. Here you can see the epithelium, which is the stratified squamous non-keratinized type, and beneath epithelium you can see the submucosa, and then the core is formed by the elastic cartilage. On other side you can also see the stratified squamous non-keratinized epithelium and the submucosa. So identification point for this slide is that you on both the sides you can see the epithelium, and in the center you can see the elastic cartilage. So now look at this diagram. This is also another slide from your histology lab, and in this you can see the one side the epithelium is present, and on other side also the epithelium is present. Beneath epithelium on both sides you can appreciate some mucosa is present, and core is formed by the elastic cartilage. So this is the slide for the trachea. This first look at this. This is the mucosa, and mucosa is consists of the epithelium and the lamina propria. In this case, the epithelium is pseudostratified columnar ciliated epithelium, and lamina propria is the loose connective tissue. Beneath lamina propria is the submucosa, and junction of mucosa and submucosa. Here you can see the elastic membrane is present, and this elastic membrane is formed by the elastic fibers, and which is evident with a special stain for the elastic fiber. So this is the submucosa, which is moderately dense irregular connective tissue which contains the glands, which are the mucus type of the gland with the serous damilunes. So this all is the submucosa, and here you can see the cartilage. So this may be the slide taken from some fetal trachea, because the still hyaline cartilage is not completely developed in this slide. This is another slide of the trachea, a beautiful slide in which you can see the stratified, pseudostratified columnar ciliated epithelium, and from you can see from here to here, this is the mucosa, and then this is the submucosa. Here you can see This area is the cartilage, and here you can see the muscle, which is the trachealis muscle is present, and outer to this trachealis muscle is the adventitia. So now look at this slide. So this mucosa consists of the pseudostratified columnar ciliated epithelium, and just beneath epithelium you can see loose connective tissue of the lamina propria. Then this is the submucosa, which is moderately dense irregular connective tissue containing glands, and this is the duct of the gland, and these are the mucous glands, sometimes having the serous damilion. This is the area where the C-shaped end of the hyaline cartilage is present, and here you can also appreciate the trachealis muscle is present, and outer to this is the adventitia. Now look at this slide. Again you can see this is the mucosa, which again consists of the pseudostratified columnar ciliated epithelium and lamina propria. Beneath this is the submucosa, which contains glands, and also these are some section of the nerves as well. And then after the submucosa there is the cartilage. This is hyaline cartilage. So this is another slide for the trachea from your histology lab. This is another slide for the trachea at lower magnification, in which you can see, first look at this. This is the epithelium, and then this is small area is the lamina propria. Then look at this. This is the submucosa from here to this area. This is the submucosa, and then this is the C-shaped cartilage. So now look at this diagram in detail. This mucosa consists of pseudostratified columnar ciliated epithelium with the goblet cell, and beneath the epithelium you can see small amount of connective tissue, which is the lamina propria. Then we have the submucosa, and here you can see the sections of the glands as well, and the nerves and blood vessels are also present. Here you can see the ducts of the glands are present. These are the sections of the different sections of glands along with their duct. Outer to this submucosa is the cartilage. So you can appreciate this is the C-shaped end of the cartilage, and here you can also see the trachealis muscle, which is present as well. And outer to this cartilage you can see over here, this is the adventitia, which is loose connective tissue. So this is the slide of the trachea at lower magnification, in which you can see complete lumen of the trachea with the mucosa, with the submucosa, with the hyaline cartilage, with trachealis muscle as well, and adventitia. Now another slide of the trachea at higher magnification, and in this slide first look at this. From here to this area this is epithelium, then from here to this area this is lamina propria, and then from here to this area this is the submucosa, and then beneath this submucosa you can see this is the beneath submucosa you can see this area is the cartilage. So now look at in detail in this slide. So this epithelium you can see consists of the pseudostratified columnar epithelium with the cilia at the top. The nuclei are present at a different level. Also you can see the goblet cell, which is also present. Then this is a loose connective tissue beneath epithelium called the lamina propria, and then this is the moderately dense irregular connective tissue, which is containing glands as well, and the ducts of the glands are also present, and beneath this is the cartilage. So this is the slide of the trachea at higher magnification to show you the epithelium, the lamina propria, and the submucosa. Now look at this diagram again. This is a beautiful slide. First we will mark this area is the epithelium and the connective tissue. Then this area is the submucosa. Then this area is the cartilage, and this is the adventitia. So now look at this slide. This is the epithelium, which is pseudostratified columnar ciliated. Beneath epithelium very small amount of connective tissue forming the lamina propria. Then this is the submucosa, in which you can see a cross section of the gland as well as the duct of the gland. Here you can also see the duct of the gland. Then this is the hyaline cartilage which is present, and then the outer layer, the adventitia, which is present, which is the loose connective tissue, contain blood vessels, nerves and lymphatics. So this is the slide of the trachea at the lower magnification. Now look at the slide of the lung, and in this slide you can see large number of the alveoli which are present. At some places you can see the thin portion of interalveolar septum, and other sides you can see the thick portion of interalveolar septum. This is the respiratory bronchioles. These are the respiratory bronchioles, and the alveolar sacs which are present on the sides. This is the section of some blood vessel which is present in this section. This is the section of the septa, connective tissue which is forming the septa, and this is again another section of the blood vessel. So this is the slide of the lung at lower magnification, and here you can see a section of the cartilage which is also present, that may be part of some bronchi. Now the same slide at higher magnification. So please look at the alveoli and their walls, and you can differentiate. This is the part of the interalveolar septum which we call as thin part of the interalveolar septum, where gas exchange is taking place, and this is the thick portion of the interalveolar septum. The difference between the two is that in thick portion you can see the connective tissue is also present. So these are the different alveoli, the respiratory bronchiole and the alveolar sacs which are present over here, and this may be the section of some blood vessel which is present. This is again another view of the same slide at higher magnification to show you the interalveolar septum. This is the thin area of the interalveolar septum, and this is the thick portion of the interalveolar septum. Here you can also see the thick portion of the interalveolar septum, and you can see in thick portion the connective tissue is present in addition to other parts or other components of the interalveolar septum. This is another very beautiful diagram of the slide of the lung at lower magnification. Here you can see the large number of the alveoli, the alveolar sacs which are present, and here you can see this is the section of the bronchiole, and these are the section of the bronchi. So how we differentiate between the two in the slide is that in the section of the bronchi you can see piece of the cartilage as well. Here you can also appreciate the small pieces of the cartilage which are forming the wall of the bronchi, while in case of the bronchiole you cannot appreciate the cartilages. Cartilages are absent in the walls of the bronchiole. So you can differentiate between these two very well in this diagram, and this is some connective tissue which may be the septum, and these all are the alveoli which are present. So this is a beautiful slide of the lung. Another very beautiful slide of the lung here at the low magnification from your histology lab, and here you can see large number of the alveoli which are present, and in addition to alveoli you can see this is the section of the bronchi, not the bronchiole, because you can see here the piece of the cartilage is present. So this cartilage piece help you to identify and differentiate the bronchi from that of the bronchiole in your slides. This may be smaller bronchioles may be present. This may be another smaller bronchiole present in the septas. So this is a beautiful slide taken from a thin segment of the interalveolar septum and the thick the section from the bronchi. So this is the epithelium of the bronchi, that is pseudostratified epithelium with the cilia which are present over here, and beneath epithelium you can see these are the smooth muscle cells which are forming the wall of the bronchi, and here you can see these are the pieces of the cartilage which are present. Here you can see the chondrocytes as well present in their lacunae, and then smaller amount of the connective tissue. So this is the wall of the bronchi to give you a clear cut view of the bronchi, and these are the interalveolar septum and alveoli. Another view of the lung at higher magnification of the alveolar valve. These are the alveoli and alveolar sacs which are present, and these are the interalveolar septum, their thin portion and the thick portions. Another view of the lung at higher magnification of the alveoli. And in similarly another view of the lung at higher magnification to show you. This is the slide taken from the bronchiole. Here is the epithelium which seems simple cuboidal over here, and beneath the epithelium you can see connective tissue is present, but the absence of the cartilage will give you a clue that this is the bronchiole. This is another slide of the lung from your slide at a lower magnification to show you the alveoli which are present. And please, dear students, remember you usually confuse this slide with that of the adipose tissue. So this is not the adipose tissue. Please remember these are alveoli and these are different from adipose tissue. Please differentiate these two slides separately. This is the slide of the larynx, a beautiful slide from your histology lab, and here you can see first mucosa, and this mucosa is formed by the pseudostratified columnar ciliated epithelium. Beneath mucosa there is the submucosa which contain the mucus type of the glands with their ducts which are present, and outer to this is the one piece of the cartilage and this is the another piece of the cartilage. So this is elastic cartilage and this is hyaline cartilage, and this is the section of the muscle, a cross section of the skeletal muscle which is taken over here, which is vocalis muscle. So you must remember this is the skeletal muscle which is voluntary in nature, and it is skeletal muscle, not the smooth muscle. These are the extrinsic muscles of the larynx. So now look at the slide of the artery. This is a beautiful slide of the artery. The medium sized artery, different first we will mark different areas. This is the epithelium and tunica intima, and this tunica intima, then outer to this tunica intima is tunica media, and this is the tunica adventitia. So these are the three codes of the arteries. Now understand these three codes. Tunica intima consists of the endothelium, which is a simple squamous in nature, and just outer to the just beneath the epithelium there is a small amount of connective tissue, and then here you can see also the inner elastic lamina or internal elastic membrane which is present to differentiate the tunica intima from that of the tunica media. This tunica media is thicker in artery as compared to tunica media of the same sized vein, and it contains a large number of the smooth muscle cells in addition to the collagen fiber. And outer to this is tunica adventitia, which is moderately dense connective tissue containing large number of elastic and collagen fiber. So these are the three codes of the medium sized artery. You can also label it as muscular artery. This is the another section. Here you can see this is the section of the artery and this is the section of the vein. So first look at the artery. This is the tunica intima. This whole area, smaller area, tunica intima. Then this is tunica media, and then this is tunica adventitia. In case of the vein, you can see smaller tunica intima, then smaller amount of tunica media, and then this whole is tunica adventitia. So differentiate between the two. Tunica intima in the artery consists of the endothelium, the subendothelial connective tissue, and very clear inner elastic lamina which is present over here. In case of the medium size, same size vein, you can see the collapsed lumen, this endothelium, and a very small amount of the connective tissue. The inner elastic lamina may be evident or it may not be present. Then the tunica media of both, the tunica media of the medium sized artery is thicker, and it consists of the large amount of the smooth muscle cells in addition to collagen fibers. Here the tunica media is smaller. It contains some smooth muscle cells as well as the collagen and the elastic fiber. Then tunica adventitia of the artery, which is the moderately dense irregular connective tissue, contain large number of the collagen as well as elastic fiber. Is compared to the tunica adventitia of the artery, the tunica adventitia of the vein is larger and it contains large amount of the fiber. So this is the section of the artery and this is the section of the vein. Then look at this diagram. This is the section of the vein. You can see the collapsed lumen, then the intima, the media and the adventitia. Another section of the vein, a beautiful section of the vein, you can see this is the tunica intima, which consists of the endothelium, some small amount of the connective tissue and inner elastic lamina. Then this is the tunica media and tunica adventitia. In the lumen you can see the blood RBCs which are present, and here you can see a section of the nerve which is also present in addition to vein, because you know in the body the neurovascular bundle is present, so you can see both the blood vessels as well as the nerve in a section. So this is another section of the vein. You can see complete lumen but it is collapsed. Then the tunica intima, tunica media and adventitia. This is another section of the artery and the vein, and this one is the artery probably, and this is the vein, the collapsed lumen. This is the slide basically taken at lower magnification, and in which you can see smaller amount of the tunica intima, media and adventitia, and in this you can see tunica intima, media and adventitia. So here you can see media is thicker as compared to media of this one. This is another section of the artery and the vein. This is the section of the artery and this one is the section of the vein, and you can differentiate between two by the amount of the tunica media, which is thicker over here. This is the section of the nerve, slightly blurred slide. So this is another slide to show you the schematic diagram of the larger size vein, and then in addition to this is a schematic diagram, and this is the H and E section of the larger vein. Just a revision slide to show you the differences, and then you will be able to understand the slides of the larger vein. So first have a look at this schematic diagram. You can see this whole area is the tunica intima. This is tunica media and this whole is the tunica adventitia. So tunica intima consists of the endothelium. These are this subendothelium, simple squamous epithelium. Just beneath endothelium there is the small amount of the subendothelial connective tissue. Then the tunica media, which is formed by the circumferentially arranged smooth muscle cell. This is a very thin layer in case of the larger vein. Then outer to tunica media is the tunica adventitia, and this tunica adventitia consists of three zones. Zone which is just beneath the tunica media contains of the dense collagen fibers in addition to elastic fibers which are present. Then a middle zone which is formed by the large number of the smooth muscle cells, and these smooth muscle cells are arranged in a longitudinal manner as in a contrast to the muscles which are present in tunica media. In adventitia these muscles are longitudinally arranged, and in addition to this these smooth muscle cells there is large amount of the collagen and elastic fiber. And the third zone is outer to this middle zone, which is also consist of the elastic and collagen fiber. So now look at this diagram as well. This is the tunica intima, a smaller amount of connective tissue, epithelium, endothelium and connective tissue. Then tunica media. Then this area is the first zone of the tunica adventitia, which consists of the collagen and elastic fiber. Then this is the middle zone, which contains the large number of the smooth muscle fibers which are longitudinally arranged. So in this section you can see the cross section of the smooth muscle fibers, and outer to this is the third zone. So these are the different zones of the adventitia, and this is the schematic diagram. Now look have a look at the slide. So this is the slide. Here you can see the lumen inside. This is the lumen, the tunica intima, subendothelial connective tissue, then media, and then these are the three zones: the inner zone, the middle zone, and the outer zone. So this is the section of the larger size artery, larger size vein. It may be superior vena cava, it may be inferior vena cava, it may be portal vein as well. So this is the slide from your histology lab, a beautiful slide. And here you can see, first have a look, we mark, this is the tunica intima. Then here is the tunica media. And from this to this hole is the tunica adventitia. Now change the color. This is the first zone, inner zone. This one is the middle zone, and this area is the outer zone. Now understand this slide. First, tunica intima, the endothelium and subendothelial connective tissue. Then tunica media, which consists of the smooth muscles and collagen and elastic fiber. Then tunica adventitia and its three zones: the inner zone, which mainly consists of collagen and elastic fibers, and middle zones, which is containing bundles of smooth muscle fibers, and these smooth muscle cells are longitudinally arranged. So you can see the cross section of these smooth muscle cells in this middle zone of the adventitia. And outer to this is the outer zone, which is again elastic and collagen fibers which are present. So this is a beautiful slide of the inferior vena cava, but you have to write large vein because you do not know whether it is inferior vena cava or superior vena cava, or it may be portal vein. So in the OSPE you have to write the larger vein. This is another slide to show you the just a revision slide to have a concept of the elastic artery, and one portion having the schematic diagram and other portion having the cross section. So we first label. This is the tunica intima, then tunica media, and then tunica adventitia. So this tunica intima consists of the endothelium, this subendothelial connective tissue, which in case of elastic artery it may also contain some smooth muscle cells as well, and then the inner elastic lamina. Then the tunica media, which contains in addition to smooth muscle cells, it contains a large number of the elastic fibers which are present, and these elastic fibers are forming the lamellas, which may be 15 to 20 lamellas in cases of the aorta, where these are present in the form of the lamellas, and also the collagen fibers are present. So the smooth muscle cells are interspersed between these elastic fiber, and outer to this is the tunica adventitia, which is containing the blood vessels, the nerves, the smaller arterioles and capillaries in the tunica adventitia. So this is the schematic diagram. Now have a look at this diagram. So this smaller area is the tunica intima, then this area is the tunica media, and then this area is tunica adventitia. So please remember, this slide is Vickers resource in focusing elastic stain to visualize the elastic lamellas interspersed with the smooth muscle cells of the tunica media. So this is the special stain for the elastic lamellas, and in which you can see the elastic fibers are present, and in between the elastic fibers the interspersed are the smooth muscle cells. So another slide for the aorta, or you can see the in larger size elastic artery. Here you can see the intima. This whole is the media and smaller amount of the adventitia, and in media you can see large number of the elastic fibers are present. This is a slide basically taken at lower magnification with hematoxylin and eosine stain, so it is difficult to differentiate the elastic fiber in this stain. This is another slide with H&E staining, and in which you can see this is the intima, this whole area is the intima, then this whole is the media, and then this is adventitia. I first label this slide. So this is the intima, then this is the media, and then this is the adventitia. So in intima you can see the endothelium and subendothelial connective tissue, and then the media consisting of large number of elastic lamellae and collagen fibers and smooth muscle cells, and outer to this is adventitia. Another slide here you can see also this is intima, this is media, and this is adventitia. This is another slide from your histology lab. Another slide, I think same slide, this is revision, repetition. So dear students, here I complete my today's class for the preparation of these slides of the OSPE for your Block C exams. And I must say thanks to Mir Shahan Masood to help me to prepare this class for you people. And thank you all for your attention for today's class. Allah Hafiz.